Neuroscientific theories and paradigms, the basics of research. So for a lot of you, this may be new information, for others just a review, but it is important that clinicians in any capacity know what is good and not good research. So I suggest reading a current journal article or two every week from a trusted source in your field to not only keep up to date with what is being explored, but also to read older articles to see where we've come and what may be some important groundbreaking work that is perhaps taken for granted now. So let's begin a little bit with evidence, research, and theory. So evidence is indicative of truth or validity about a belief or proposition. It is information that's based in fact, ideally, and not conjecture. It is an outward sign of or furnished proof. So research is used to answer a question or questions. It's possible explanations for situations or conditions, and it is conducted systematically and empirically. Now, a theory ideally is based on sound studies. It's based on unbiased information. The definition of this is an idea or set of ideas that is intended to explain facts or events. It's often presented as possibly true but not yet proven. A plausible or scientific adaptable general principle, often to explain a phenomenon or a belief. So, however, sometimes bias slips in here with this. Money, politics, and personalities can oftentimes get in the way. I encourage you to set those things aside and to read things both on both sides, perhaps, of an argument, and deciding for yourself what's good research, what's not good research, what information you should keep in your brain, and what you should let go of. We'll start out with basic science and clinical research. So basic science is generally done in a laboratory. I think about this as it's stuff that's in a petri dish. So it's looking at cells, it's looking at tissues, and it's also taking stock of chemical reactions. It's not generally concerned with how a person responds or reacts to an intervention. The focus is really about mechanisms and functions that are related to health and illness. Whereas clinical research is focused more on procedures and treatments. Think about medications, think about chiropractic adjustments, think about some kind of specific massage technique. It's really focused on what happens when how a person responds to a certain intervention. It's used to determine safety and effectiveness, again, of medications, devices, diagnostic procedures, and the treatment regimens that are generally intended for humans. So research design kind of falls into three big categories, right? There's qualitative, quantitative, and mixed methods. When we think about qualitative research, these are things that help to give us an understanding of human perception, emotion, or behavior. Data is collected through interviews and focus groups and direct observation. The hallmark truly of qualitative interviews and focus groups is it's really about open-ended questions, where quantitative research methods are used to describe observations or relationships in numeric terms. These are more directed questions, yes, no, positive, negative, Likert scales, 0 being nothing, 10 being the worst that has ever happened, and then of course all the gradients in between. It's collection through data collection through questionnaires, laboratory tests, imaging, and other ways that can be coded or numerated. Mixed method studies are something that are relatively new, and this is a combination to enhance the other. So you may start out with a quantitative questionnaire where a person answers on that Likert scale, and then you may ask them, so can you give me a little bit more how you feel about this topic that we're discussing. So, and it can also start out with more qualitative type questioning, and then use the quantitative data to actually enhance what they've learned in the qualitative studies. The thing to remember about this is that qualitative methods, qualitative studies is not just mashing together. A good qualitative study is not just about mashing together quantitative and qualitative research. It truly is something that stands apart and alone, and none of these types of research design is easier than the other. They all have their benefits, they all have their drawbacks. There are 7 of the most common types of research studies, beginning with the least stringent and ending with the most conclusive. So beginning with case studies or a case report. So with this, it's usually a unique case in a clinical practice. There's oftentimes one client, one patient, one playground. It's usually a single event type of thing. It's one session. It could be several sessions, but it's just with that one client or one patient. Now, this can either be prospective or retrospective. So just like it sounds, prospective is something where a person gets followed along over time, where retrospective is where they might pull a file and say, hey, you know, this person got better. I wonder why. Let's look back at some of the things that we did, and then we can write up a case study or a case report around that. So the next is a case series where it's observations of a series of patients without a control group. That's a very important concept to keep in your mind. Similar population, similar treatment, and again, this can be prospective or retrospective. The next is case control. With this, we begin with a group of cases who have similar outcome. The cases are compared to a control group, but there are some differences here that are going to be pretty important when we start talking about randomized clinical trials. So they've got similar demographics, but they lack a condition or an outcome. It's really done to see if there is a difference due to exposure. This again can either be retrospective or prospective. Talking about cross-sectional, this is a snapshot or a cross-section of a specific population. So an example would be a health or behavior at a certain point in time. Something like the US Census would be a good example. So it's the same or similar demographics, and again, this can be prospective or retrospective. And we've got cohort or longitudinal. This one, we start with a large group of people with similar demographics, but they do not have a condition. Researchers follow the group over a long period of time and categorize them into different levels of exposure. So they're looking to find out if they can determine certain things that might happen to a person over time. Participants have not developed any kind of outcome of interest. By definition, this is always prospective. Looking at randomized clinical trials. Now, these are oftentimes thought of as the gold standard in research, and there are some positives and some negatives around this, which I'm not going to get into right now here. It's a little bit more than what I want to go over. So in randomized clinical trials, or RCTs, they use at least 2 groups. So there's a treatment group and a control group. The purpose is truly to find a causal relationship, cause and effect type of thing. These are always prospective, and the hallmark of a really good randomized clinical trial is that they use blinding and randomization. Ideally, the reason for this is to remove any kind of potential bias. Now, the last type of research that I want to talk about is summary research. So both of these, so there's systematic reviews and there's meta-analysis, and both of them attempt to find all of the studies of a topic. They use inclusion and exclusion criteria to form broad overview of findings, and it's often used in the creation of practice guidelines, and it's used a lot in textbooks. So with the systematic reviews, they are gathering everything in all the research that's been done, published, using both looking at qualitative and quantitative studies, where a meta-analysis is really just looking at the numbers. So they're gathering studies that are basically just quantitative. In summary, there are multiple ways to find and use research. I encourage you, in fact, one of your assignments is to go to the NWHSU library and find some articles. But it's important also to know what constitutes good research, what constitutes perhaps bad research, and what are some of the defining characteristics of each one of these types of studies. So, you know, it's important to use reputable sources for information, and those things also help us to become better clinicians.